Welcome to the USCHA. This workshop is entitled NIH Stakeholder Engagement in the Era of COVID-19 and Social Justice Movements, Priorities for Fiscal Year 2021. I'm Maureen Goodenow, the Associate Director for AIDS Research and the Director of the Office of AIDS Research at the National Institutes of Health. The objectives of this workshop are to provide an understanding of the NIH HIV/AIDS research program, outline the role of stakeholder input into informing the NIH research agenda, and describe NIH research priorities for fiscal year 21. Today, I'll be joined by Dr. Carl Diefenbach, the Director of the Division of AIDS at the National Institute of Allergy and Infectious Diseases, Dr. Monica Webb-Hooper, Deputy Director of the National Institute of Minority Health and Health Disparities, Dr. Karen Parker, Director of the NIH Sexual and Gender Minority Research Office, Dr. Diane Rausch, Director of the Division of AIDS Research and Director of Global Mental Health at the National Institute of Mental Health, Dr. Sonia Lee, Acting Branch Chief for Maternal and Pediatric Infectious Disease Branch at NICHD, National Institute of Child Health and Human Development, and Dr. Melissa Gerald, Program Director in the Division of Behavioral and Social Science Research at the National Institute of Aging. In the next slide, the overview, what my presentation is going to be about is an overview of the NIH AIDS research program and the role of stakeholder engagement. I have nothing to declare. And on the next slide, which we're looking at now, is the vision and mission of the NIH NIH HIV/AIDS research program. The vision is to advance research to end the HIV pandemic and improve health outcomes for people with HIV. The mission is to ensure that NIH HIV/AIDS research funding is directed at the highest priority research areas and facilitate maximal return on the investment. In the next slide, we outline some of the key OER functions. OER was established by Congress in 1988 to develop an NIH HIV strategic plan that was based on current scientific priorities and to allocate the HIV budget. So the Office of AIDS Research is authorized to establish research priorities, develop the strategic plan for HIV research, ensure that funds are invested in the highest scientific priority areas, and address emerging needs. OER coordinates the scientific, budgetary, legislative, and policy components of NIH HIV/AIDS research. In fiscal year 20 to 25, there's now a new NIH strategic plan for HIV and HIV-related research. OER develops this strategic plan, and the plan provides a roadmap for NIH HIV/AIDS research. And it builds on scientific progress and opportunities for advancing research towards ending the HIV pandemic. The plan has shifted to a 5-year cycle, and this aligns with the overall NIH strategic plan, the National HIV/AIDS Strategy, and the National Viral Hepatitis Action Plan. Input from a broad array of stakeholders and subject matter experts is solicited and incorporated into the plan, which outlines 4 strategic goals. 1, advance rigorous and innovative research, ensure flexibility and responsiveness, promote dissemination and implementation of discoveries, build human resource and infrastructure capacity. And the strategic plan is the document that guides NIH in addressing NIH research, HIV research priorities. And these are outlined on the slide that you're seeing. And basically, funding is allocated based on these priorities. And the 4 main priorities include reduce the incidence of HIV, develop next generation therapies for HIV, conduct research towards an HIV cure, and address HIV-associated comorbidities, co-infections, and complications through research designed to decrease and or manage these conditions. And then a really important part of the HIV strategic plan is the advanced cross-cutting areas of research. And this encompasses basic sciences, behavior and social sciences, epidemiology, implementation science, information dissemination, and research training. And all of these categories interdigitate and overlay the four priorities, the four main priorities. In the next slide, it shows how the NIH HIV research strategies interdigitate and harmonize with priorities for ending the HIV epidemic in the United States. While there's not a one-to-one crossover between the strategies and the goals for EHE, there's nonetheless a good synergy and an overlap in terms of the objectives. In the next slide, we show more about how the NIH research agenda interdigitates with ending the HIV epidemic in the United States. And research at the NIH really is a continuum from very basic research on the left side of your screen to where the products of the research, after going through clinical, translational, implementation steps, really can impact public health policy and public health in general. We really work closely with our partners across the spectrum so that a lot of these activities, while they initiated the NIH, really evolved to include other agencies and other stakeholders. In the next slide, we actually have robust interactions with stakeholders. Some of the findings from the listening sessions that we've been conducting over the last almost 2 years now include maintaining a robust research portfolio, the need to increase and build relationships with diverse communities across the United States and globally, facilitate communications between NIH and our public health officials at the state and local levels, and ensure that we are strong and effective partners with other federal offices. And we also heard during these listening sessions that there's a need for increasing support for next generation researchers. In the next slide, we talk a bit about the FY21 priorities to address stakeholder feedback. And the OAR and the NIH overall are committed to addressing equity and inclusion in the NIH research enterprise through true bidirectional partnerships with communities most impacted in the research, inclusion and equity in NIH-sponsored clinical trials, and employing novel strategies to ensure the NIH workforce is more representative of the epidemic. The partnerships with the research communities in the NIH has been a key driver in the accomplishments in the HIV research field, and is this work that has allowed us to jumpstart in other research areas, particularly with COVID-19. In the next slide, shows the geographical distribution of COVID-19 in the United States relative to, on the left panel, relative to HIV in the right panel. And as you can see, there are glaring overlaps including in the Southwest, but notably in the Southeast. Both COVID and the racial justice movement in 2020 have shown a spotlight on the disparities that we have known about in the HIV epidemiology and the HIV field for decades. The immediate impact across our HIV research activities prompted NIH institutes and centers to develop and issue new HIV funding opportunities to assess the impact of COVID-19 on HIV comorbidities, co-infections, and complications, examine the risks and outcomes for COVID-19 in substance-using and HIV-affected populations, and conduct research to address the intersection of COVID-19, mental health, and HIV treatment and prevention. In the next slide, we are now going to hear from the different ICs and the speakers on our panel today about the focus of each of their activities in the across the board on our HIV priorities and objectives. In the next slide, we want you to stay connected, and these are ways that you can do so with the NIH and with the OAR. And then in the next slide, I want to thank you for taking part today, and I am privileged to introduce the next speaker, Dr. Carl Diefenbach.
Hello, everybody. It's a pleasure to join you today. It's my opportunity to talk to you about the role of the NIAID in setting the priorities for FY21. So these are the strategic priorities of NIAID and the Division of AIDS. As you can see, these align incredibly closely with the priorities that Dr. Goodenow just showed. So what we have within NIAID is to provide the scientific basis for achieving an end to the HIV pandemic by developing safe and effective HIV vaccines, as well as important other combination prevention strategies, novel therapeutics, and approaches to treatment and cure of HIV infection. The division, in addition to these priorities, spells that out in a little more detail. We seek to support the infrastructure and research needed to end the epidemic in areas of reducing incidence through the development of an effective vaccine and biomedical prevention strategies, development of novel approaches for treatment and cure, co-infections and comorbidities, and ultimately also through partnerships with scientific and community stakeholders to develop and implement the effective interventions. So in fiscal year 21, I thought it'd be important to lay out our scientific priorities and what we are seeking to fund at a very large macro level. First and foremost, this is the fiscal year in which we re-up and reshape the HIV/AIDS clinical trials networks. The main networks that we are seeking to, the research areas are listed there on the slide. These awards will be announced formally the last week in November or the 1st of December. Additionally, we are seeking to continue our programs in the HIV cure. And for your own information, all of the FY21 activities that NIAID intends to engage in the HIV/AIDS space have already been approved by the NIAID Council and the AIDS Research Advisory Committee. I was asked to talk briefly about the impact of coronavirus disease and the Black Lives Matter movement on our research. And I think it's really interesting how these two very important events in the United States have come to impact what we are doing. Back when the epidemic started to emerge, many labs across the United States were forced to close. And in order to keep working, many were able to pivot to coronavirus disease research and studies specifically on the viruses. Additionally, because of our structure, and because we are virologists, immunologists, people involved in clinical trials, we were asked to bring our knowledge, skills, and ability to the table to help play major roles in the areas of vaccine prevention and treatment. Now, where these two really came together was how we were able to work with the community and the Operation Warp Speed and the vaccines teams to really work hard to assure that we have racial, age, and comorbidity distribution in the trials that are at a minimum are aligned with the demographics of the country, and ideally seeking to enroll studies at reflecting the demographics of the actual coronavirus pandemic. Other activities that we have continued has been the completion of our major ongoing HIV clinical trials, and we look forward to being able to have profound impacts on not just one pandemic, but two. That's what I was going to talk to you about today, and now it is my pleasure to stop my screen sharing and introduce our next speaker. Our next speaker is Dr. Monica Webb, and she will start sharing her screen now. And Monica, it's a pleasure to invite you.
Thank you. Thank you very much. Good afternoon. I'm Dr. Monica Webb Hooper, Deputy Director of the National Institute on Minority Health and Health Disparities. And my presentation is on the inclusion of people living with HIV in minority health and health disparities research. The NIMHD's mission is to lead scientific research to improve minority health and reduce health disparities. We envision an America in which all populations will have an equal opportunity to live long, healthy, and productive lives. To accomplish this, we raise national awareness about the prevalence and the impact of health disparities, and we disseminate effective interventions to reduce and encourage the elimination of health disparities. These are the NIH-defined populations that experience health disparities. We prioritize racial and ethnic minorities as defined by the Office on Budget and Management, individuals of less privileged socioeconomic status, underserved rural residents, and sexual and gender minorities. And health disparities refer to a health outcome that is worse in these socially disadvantaged groups, in part due to discrimination and being medically underserved. Our funding announcements focus primarily on social and structural areas of HIV research, specifically examining the social determinants of HIV and health outcomes in vulnerable populations, and addressing HIV-related disparities. And here are examples of recent and upcoming funding opportunities. So they focus on engaging youth and young adults in the HIV treatment cascade, studies of PrEP to prevent HIV, prevention interventions for individuals at the highest risk of infection, promoting viral suppression, and also addressing HIV/AIDS disparities among women, all with a focus on populations who experience health disparities. NIMHD has prioritized research supporting the goals of the Ending the HIV Epidemic initiative, whose objective is to make substantial reductions in new HIV infections in the United States over the next decade. So this initiative will support projects that test the effectiveness of multi-level interventions to prevent HIV infection in high-risk health disparity populations or in subgroups in one or more geographic hotspots. You know, it's important to engage individuals in local prevention efforts through, for example, culturally relevant outreach. And for such programs to be effective, they must also address the social determinants and the local circumstances that impact the potential for HIV risk reduction. We also encourage interventions to encompass multiple domains, drawing from the NIMHD research framework, which serves as a vehicle for encouraging NIMHD and NIH-wide research that addresses the complex and multifaceted nature of health disparities, including research that spans different domains of influence and also that span different levels of influence. And of course, when you look across these domains and the levels, you can see multiple areas of direct relevance to HIV prevention and management. Now, the current set of circumstances has brought into sharp focus just how much and how quickly COVID-19 has directly threatened efforts to prevent and treat HIV/AIDS, both domestically and globally, while simultaneously highlighting the continued inequities that drive pandemics like COVID-19 and HIV in marginalized communities. So I want to highlight just one of several large-scale initiatives, and this one is known as the Rapid Acceleration of Diagnostics Underserved Populations, or RADx UP initiative. Briefly, RADx Up is focused on testing. We have to ensure that testing and repeat testing and contact tracing reaches the groups with additional risks. And this is a consortium of linked community-engaged research projects focused on increasing access and uptake of COVID-19 tests in vulnerable and underserved populations, and that also considers the ethical, social, behavioral implications of testing under-resourced groups. So what happens when you test underserved groups? What are the next steps, especially among individuals who may not have the privilege of being able to self-isolate? And how do we make sure that patients interpret their test results correctly, among other questions that this initiative will address? RADx Up is NIH-wide, so all of the institutes and centers are supporting this, and we are prioritizing populations that are underserved as well as that are COVID-19 vulnerable due to medical, geographic, and social factors, including people living with HIV or AIDS, as well as several other priority populations. So I thank you for your attention, and I invite you to connect with NIMHD. And now I have the honor of introducing the next speaker, Dr. Karen Parker.
Great, thank you so much, Monica. So as Monica mentioned, my name is Karen Parker, and I serve as the Director of the Sexual and Gender Minority Research Office at the National Institutes of Health. Whoops. So I'd first like to start by talking about the way that NIH defines sexual and gender minority populations. So in late 2019, NIH updated our definition of SGM populations. Instead of defining the population as LGBT, NIH for many years has used the phrase SGM to be more inclusive of populations that may not see themselves within the L, the G, the B, or the T. And so our definition is really as inclusive as possible, and we want those even who do not maybe self-identify with one or more of the terms listed here, but whose sexual orientation, gender identity or expression or reproductive development is characterized by non-binary constructs of sexual orientation, gender, and or sex, to know that they're really a part of the mission of our office and the priority of SGM health research at NIH. The Sexual and Gender Minority Research Office does not have grant-making authority. However, we do work across the institutes and centers of the agency in order to increase research on SGM populations. One of our signature programs is an administrative supplement program, and so we work with the institutes and centers to fund research. In FY 2020, we funded 14 administrative supplements, and 4 of those were related to HIV, and they were all co-funded with support from the Office of AIDS Research. You'll see from this slide that the 2020 administrative supplements related to HIV really spanned many different disease questions. So thinking about things like stigma and clinical outcomes. Some of these looked at different populations. So we have a study looking at adolescents in the United States. There's a study in Uganda, and of course, some additional work on PrEP. In terms of COVID-19 and sexual and gender minority communities, what we know are that sexual and gender minorities do encounter many unique health disparities. So this includes, in general, worse health-related quality of life, significant risk for adverse mental health outcomes. We know that there is a great risk for mistreatment, discrimination, and violence, particularly in transgender and gender nonconforming populations. And we know that experiences of stigma and minority stress have negative clinical implications for sexual and gender minorities. And so in terms of the intersection of race and SGM status, we do know that many racial and ethnic minority LGBT adults are more likely to be unemployed compared to the general population, and that there are also other specific diseases that are much more likely. For example, Black, lesbian, gay, and bisexuals are more likely to have diabetes. And then of course we see that Black and Latinx men who have sex with men and Black transgender individuals are more likely to be infected with HIV. We also know that SGM racial and ethnic minorities encounter minority stress and stigma related not just to their SGM status, but also to their racial identity. And this can have very distinct and often exacerbated effect on a variety of different health outcomes. And so where does that lead us with COVID-19? So what we know is that we don't really know much that we should know. So there's very little data out in terms of COVID research and sexual and gender minority status. We do know that sexual and gender minority people in general are at greater risk of economic related issues. And so they're more likely to work in industries that are adversely impacted by the pandemic and to experience higher rates of unemployment, and they're more likely to live in poverty. SGM people also have greater risk of health-related complications. And so you can imagine higher rates of chronic conditions such as asthma, cardiovascular disease, obesity, and HIV/AIDS really posing a real threat to complications to COVID-19. And we know there are higher rates of smoking, vaping, and other substance use within SGM populations. So when you think about the impact of SGM racial and ethnic minorities, given that SGM racial and ethnic minorities are encountering even greater economic and health challenges, they are at even greater risk for adverse outcomes related to the pandemic. And so thinking about things like folks who are more likely to be living with HIV compared to others, and also SGM racial ethnic minorities, particularly Black sexual and gender minorities, who are more likely to be unemployed, living in poverty, or have limited access to health care. And so the key takeaways are really that we must ensure that SGM populations are included in all of the COVID-related research and related initiatives at NIH and beyond, and that we really need to make sure that we're collecting data and analyzing data of both sexual orientation and gender identity in research and clinical settings so that we can really understand what's happening within SGM populations, in particular, what's happening within SGM persons of color populations. And so with that, I would like to say thank you, and I'm happy to be here, and I thank OAR for the invitation. I would now like to introduce our next speaker, who is Dr. Diane Rausch from the National Institute on Mental Health.
Good afternoon. I'm Diane Rausch, and I direct the Division of AIDS Research at the National Institute of Mental Health. The mission of our institute, our division, is to support research to reduce the incidence of HIV/AIDS worldwide and to decrease the burden of living with HIV. We have two major programs: behavioral and social science research and neuroscience. Behavioral and social science research priorities are to improve uptake and adherence to the prevention and treatment cascades through translation and implementation science, integrating biomedical advances with the understanding of the basic and social science complexities. The neuroscience priorities target understanding HIV impact on mental health through understanding pathogenic mechanisms of HIV and neurofunction, HIV reservoirs that may impact cure efforts, and efforts to prevent or treat them. We propose that mental health is integral to prevention and treatment efforts across the lifespan. We support research from discovery science through translation and implementation science to assess effectiveness broadly. Our model includes continuous bidirectional information flow to allow findings from each stage to inform new and better approaches to achieve success. This is a brief overview of the NIMH HIV research agenda. In the behavioral science area, our key purpose is to develop, test, and implement current and novel interventions to prevent the spread of HIV infection and improve health outcomes through theoretically driven behavioral and social science. We target key populations using state-of-the-science technology to not only develop and test new strategies, but to establish effective strategies to scale. Listed here are some of the key determinants which can have an impact on health outcomes. And underlying all of our work is a focus on mental health. Also, this is a brief interview of the neuro-HIV agenda, the basic neuroscience. We have three major research areas: therapeutics, pathogenesis, and eradication. We know that HIV gets into the central nervous system very soon after infection and persists there. Our priorities are to understand the pathogenic effects of having HIV in the CNS, how to eradicate it, and how to prevent or treat the neuronal dysfunction associated with HIV in the CNS, with the ultimate goal of maintaining normal neural function. So this slide lists some of our current priorities that are FOAs and NOCs that target all of our programs across the Institute, but I'm highlighting a couple here, the two on social stigma and intersectional stigma, which is a very high priority for our Institute right now. We also recently had an implementation science FOA to target the mental health and the effects on the HIV epidemic efforts. And finally, we have a current RFA in publication on the role of myeloid cells in persistence and eradication. So now to turn to COVID. COVID-19 has a significant impact on health, including stress of becoming infected, keeping families safe, social isolation, food, job, or housing insecurities, and many more. And NIMH has published or participated in several announcements to better understand the impact of COVID-19 and how to address it. So on the NIMH website, there are a number of information vignettes, et cetera, to help people cope with it, targeting with places to go to get help, and targeting children as well as adolescents. And finally, I would like to discuss the impact of racial justice movement on mental health. Our director, Dr. Josh Gordon, is very passionate about dealing with the impact of the racial justice movement on mental health. He has posted many notices, particularly around the increasing crisis of Black youth suicide. And he also posted a very strong letter of support with Dr. Francis Collins, denouncing the horrific acts of violence perpetuated against African Americans, as well as the ongoing bias and prejudice that fuels these acts. He's further joined him in recognizing that we at NIH, and particularly at NIMH, have a role to play by ensuring that we foster a culture of inclusion, equity, and respect for one another. So with that, I thank you, and I will now turn it over to Dr. Sonia Lee.
Thank you so much, Diane. Good afternoon. My name is Sonia Lee. I am the Acting Branch Chief for the Maternal and Pediatric Infectious Disease Branch at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Thank you so much to the OAR for inviting me to this workshop. The NICHD underwent a strategic planning process where we revised our mission and our vision statements. NICHD's mission is to lead research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. In summary, our vision is healthy pregnancies, healthy children, healthy and optimal lives. The strategic plan provides an overview of the research that will be guiding over the next 5 years. The plan proposes key scientific and public health priorities to advance research, methods to enhance scientific stewardship, and goals to support innovation in management practices and accountability. The plan also identifies areas in which NICHD can lead, partner and collaborate, and invest in training and infrastructure. We will provide updates on our progress on implementing our strategic plan, on the research priorities, and on efforts to improve scientific stewardship, management, and accountability of resources. The 5 themes will enable NICHD to focus its efforts on the most significant public health challenges and advance science in these areas of priority. The Institute will measure progress towards these priorities, analyze the scientific, clinical, and public health impact of its research, and periodically report on metrics to stakeholders. Turning now to the NICHD HIV/AIDS research priorities, the mission in this area is to support domestic and international research, as well as research training and career developmental programs related to the epidemiology, diagnosis, clinical manifestations, pathogenesis, transmission, treatment, and prevention of HIV infection and its complications, particularly in infants, children, adolescents, and pregnant and non-pregnant women. As the HIV epidemic has evolved and other infectious diseases have emerged, both in the United States and globally, we have ensured that its funded research reflects these changes and addresses important opportunities and gaps as they arise, including HIV-associated co-infections such as tuberculosis, hepatitis, and malaria. And of course, to meet the needs and ongoing challenges of other significant infectious diseases, NICHD also coordinates our HI research on other congenital infections such as Zika, cytomegalovirus, and emerging infectious diseases such as COVID-19, and vaccine preventable disease in infants, children, adolescents, and women. On this slide, I just wanted to include here several HIV/AIDS networks in which we conduct our research that is in collaboration with different partnerships and different institutes, many that you have heard from today. I also wanted to emphasize that NICHD has a significant endeavor in data sharing, and we do this through the Data and Specimen Hub. Many of our studies provide a centralized resource for researchers to share de-identified data funded by NICHD, as well as a portal for requesting biospecimens from selected studies in DASH. HIV/AIDS, as circled here on this slide, is a main contributor to studies available for you to use for your own research. The Biospecimen Hub also has specimens from HIV/AIDS studies that we've supported. And on the bottom of the slide, I've included an FOA that provides support for R21s using archive data and specimen collections to advance maternal and pediatric AIDS research. I did briefly want to list on here some NICHD COVID-19 select scientific initiatives. For example, we had a workshop related to COVID-19 and pregnancy, looking at clinical research and therapeutic updates. A video cast is available for you to watch. We're also part of a study through one of our collaborative HIV networks in Impact, which is looking at remdesivir in pregnancy. And then we're also part of RADx Radical and RADx underserved populations that Dr. Monica Webb-Hooper spoke so completely about earlier. And then on this slide, I wanted to provide an overview of how NICHD is coordinating a collaborative program to achieve its pediatric goals in COVID-19, specifically focused on multi-system inflammatory system in children, or MISC. My final slide that I know that we wanted to talk about in this workshop today is thinking about how we're addressing social determinants and structural racism for equity within our research. The NICHD Office of Health Equity fosters the assimilation of health disparities and health equity research across research and training portfolios, identifying priorities and developing metrics to assess progress toward NICHD's diversity, inclusion, and equity goals. We're coordinating the development of innovative approaches to not only diversifying the biomedical and biobehavioral workforce, but making sure that our research is also looking at opportunities to address social determinants of health in our health disparities research portfolios. So thank you so much for your attention. Here's my contact information. And now I'd like to turn over the workshop to Dr. Melissa Gerald.
Thank you, Sonia. Allow me to share my slides. I'm Dr. Melissa Gerald. I'm a program director in the Division of Behavioral and Social Research at the National Institute on Aging, and it's a pleasure to speak to you all today. My presentation is going to be on HIV and AIDS research supported by the National Institute on Aging and our main interests in this area. Let's see here. So the mission of National Institute on Aging is to support and conduct genetic, biological, clinical, behavioral, social, and economic research on aging, and to foster the development of research and clinician scientists in aging, provide research resources, and to disseminate information about aging and advances in research to the public, healthcare professionals, the scientific community, among a variety of different audiences. The National Institute on Aging's three main strategic directions for research for 2020 to 2025 are to understand the dynamics of the aging process, to improve the health, well-being, and independence of adults as they age, and to support the research enterprise. As shown on this organizational chart, the NIA is comprised of the Office of the Director, the Division of Extramural Activities, and the Intramural Research Program. And we have 4 extramural research divisions, including the divisions of Aging Biology, behavioral and social research, geriatrics and clinical gerontology, and the Division of Neuroscience. As shown here, we have the Office of Special Populations, because NIA recognizes that health disparities are associated with a broad, complex, and interrelated array of factors: diagnosis, progression, response to treatment, caregiving, and overall quality of life. Each of these may be affected by race, ethnicity, gender, and socioeconomic status, age, education, occupation, and other as yet unknown lifetime and lifestyle differences. And given NIA's broad interests in health disparities research, which is supported across all 4 of our research divisions, NIA has the Office of Special Populations, which works across the Institute to support and strengthen our mission in understanding and redressing health disparities for older women, minorities, and people with disabilities in our aging research. And as we at NIA strive for justice and meaningful change, NIA continues to support research that can promote health equity, eliminate health disparities, and enhance the diversity of the scientific workforce. NIA's program interests related to racial justice and COVID-19, specifically, we're interested in cross-national data infrastructure development and comparative research about causes of health disparities, macro social trends, and variation in population aging. We're interested in multi-level research on mechanisms operating throughout and across the life course that can create and prevent health disparities, and mechanism-based intervention research that can help reduce and eliminate these disparities and improve healthy aging and well-being and life expectancy. We're interested in research on disparities in health systems and access to care that could exacerbate and both spread and health outcomes for those who contract HIV. And we're interested in studies on COVID-19 infection in older people living with HIV, and particularly with regard to socioeconomic status differentials, immune aging, multimorbidity, and neurodegeneration, cognitive impairment, and including post-acute sequela. We also encourage secondary analysis of existing data sources, and most notably those that NIA has funded. And some examples of publicly available data sets with HIV and AIDS-related variables include HALSI, which is the Health and Aging in Africa. It's a longitudinal study of an in-depth community in South Africa. The Health and Retirement Study, Aging with Pride, National Health, Aging and Sexuality and Gender Study, NSHAP, the National Social Life, Health and Aging Project, and MAX WIAHS Combined Cohort Study. And so with older adults, among the people who are most vulnerable to COVID-19, and given our great interests in redressing health disparities, NIA has been acting as a major player at NIH in rolling out and in participating in numerous new funding opportunities for research focused on COVID-19, including several emergency competitive revision award programs and supplement programs, so we can accelerate funding and discovery of areas that I had mentioned earlier. As my colleague, Dr. Monica Webb-Hooper, has already, beautifully discussed, NIA is also participating in the Rapid Acceleration of Diagnostics, or the RADx initiative, and its 4 programs that can help to catalyze the scientific community to improve COVID-19 testings technologies, capacities, and accessibility, and to understand and close the disparity gap in COVID-19 testing. NIA remains committed to understanding how biological, clinical, and socio-behavioral processes affect older adults with HIV and their caregivers, and the social, economic, and health consequences of HIV. And so we list our main research priorities in the multidisciplinary studies of HIV/AIDS and aging funding opportunity announcement, which include, but are not limited to, interactions among HIV and AIDS and other diseases, social structural variables, and population aging, including in low-income areas such as sub-Saharan Africa. And this is to understand how individual, interpersonal, social, structural, and other factors contribute to physical, psychological, and economic well-being, interactions among aging-related genetic, molecular, and cellular changes with HIV risk, infection, and pathogenesis, interactions among HIV infection, treatment, and development of progression of cognitive decline, Alzheimer's disease and related dementias, and other dementias, and other disabilities in older adults, and interactions of HIV interaction and treatment with other aging-related diseases, conditions, and syndromes, and geriatric approaches to assessment and management of older adults with HIV. As we continue to support HIV/AIDS research through other programs, we have our Centers for AIDS Research, CFARS, HIV infection of the central nervous system, pathogenesis of age-related HIV, neurodegeneration, the MAX-WIHS combined cohort study, the concept for CNS and HIV antiretroviral therapy effects research charter has been approved, and career development awards, fellowships, diversity and reentry supplements, conferences, grants for early medical surgical specialties, transition to aging research, our GEMSTAR program. I want to thank you very much for this moment. And now I want to hand it off back to our host here. Let's see here. If I can just close my slides here. There we go. I would like to hand this over to Dr. Maureen Goodenow right now. Thank you very much for your time.
Good afternoon, and thank you all for your participation in this conversation this afternoon. And I want to thank all the folks that we can't see, but I'm sure out there, all our stakeholders and supporters for the HIV research agenda at the NIH. Thank you again, and we look forward to having a conversation and answering some questions.